Hello and welcome to Kauai Health's Community Engagement webinar. My name is Deborah Volison and I'm the Director of Community Engagement, and today is Thursday, April 28th, 2022. We were just talking in here about how it seems like the year is just flying by. We're entering May, and we have a lot to talk about today, Gary, though, so
Yes.
I'm going to jump right in because we're going to be covering COVID stats, patient and employee memorials, new ED visitor policies, parking issues, which is always a concern to everyone. And then we're going to finish up with some social media comments and different things about our recently published articles about Kauai Health's new facility.
Okay.
So is that enough for you?
Yeah, no, it sounds like a full hour of conversation. And again, would welcome chats, and I don't know how they can also communicate with us live.
They can email me, they can text me.
Yeah, certainly. So if anything just pops into your mind, just something you weren't thinking about, or maybe something that I comment on that you want a little bit of clarification or a follow-up question. So great to be with you all here on this beautiful Thursday morning. It's just absolutely gorgeous weather outside, and so great to have Maria and Daniel. And do you notice, well, I know Deborah and I haven't been wearing masks for some time, but we were very excited that this past Monday, in response to changes at the state level, that we were actually able to modify our own internal masking policy so that effective Monday, all of our employees who are fully vaccinated, which means the two Pfizer vaccine shots plus being boosted, that if you've met that fully vaccinated status and you work in a building like the one we're in right now where no patient care is provided, then you no longer have to wear a mask. So we couldn't be more excited. The simple things in life now mean so much to us. So we don't feel guilty or like we're breaking rules. Okay, so I'll start with the numbers, and they continue to be trending in a very positive way. As of this morning, we only had 7 COVID positive patients that were in the acute medical center. None of them were in the ICU. They're all in medical surgical beds. None of them are on ventilators, but most all of them, if not all of them, are receiving some level of oxygen support. So maybe on a nasal cannula, a BiPAP or CPAP machine. What's really interesting is we haven't had a new COVID admission to the medical center in probably a month. So these 7 patients have been with us for a very long time, because almost every single day over the last month, we've been at 7 or 8 COVID patients. So we've been at 7 now for I think 4 or 5 consecutive days, and it appears that these are the same 7 patients, that they're not so severely ill that they've had to go into the ICU or the ICCU or be ventilated, but they're just having kind of a long haul of this. So we continue to pray that they make a full recovery, and that ideally our COVID census drops down to 0. Things are definitely, thank you, Maria. So in terms of the, I guess the overall busyness of the hospital, it also has definitely kind of tempered back a bit. I would say we're still very busy. We were at 90% occupancy this morning, so that still obviously sounds like a very high level. But when it wasn't too long ago that you were at 110, 120%, when you're counting all the patients that are holding in the emergency department waiting for a bed to open up, 90% actually feels like you're able to take a breath. So we actually, between our 2 ICUs, our 21-bed medical ICU on 3 West and the 20-bed cardiac ICU in the Asequia Wing Tower, we had 16 open beds. We only had 9 patients in the emergency department this morning that were holding for a bed. So things are definitely going in the right direction. We have less than 20 of our employees that are out on a COVID leave, and a number of them, actually date back to 2021 and 2020. that just are unlikely that they're going to come back to work. And unfortunately, you have heard a lot of stories about just the long-term lingering effects of COVID. And I know a number of people, myself, that just continue to not be able to shake it entirely. And so I suspect that really some of our employees are experiencing that as well. In terms of our vaccination rate, I think I reported a couple weeks ago that because for healthcare workers, we're no longer considered fully vaccinated unless we've received a booster shot. So now we pretty much, all of us got Pfizer. That was the first vaccine that was available, although I think a lot of our employees also got Moderna, who got it later on. So to be fully vaccinated as a healthcare worker, you have to have that initial regimen, and then you have to have a booster. And so we're still down around 70% of our employees are fully vaccinated as having had that first booster shot. So, but that number is ticking up because if you originally got vaccinated, but then you chose not to get a booster, then you're essentially considered unvaccinated, and now you have to be tested twice weekly for COVID. So that's caused a number of people to kind of just reconsider that. It's kind of a pain, obviously, to have to go through that twice-a-week testing, and so they chose to go ahead and get the booster shot. So I think we ticked up, I think we were at 66% a couple weeks ago, and saw that number came up slightly more over the last couple weeks.
Okay, so we're going to jump down. I know we're going to talk about the booster. I'm going to move that up in the conversation since you're there. So what is the optimal waiting time for somebody to get another booster if they've already had a booster?
Okay, so you're talking 2 boosters. What's the time then?
So, like, let's say, for me,
Right.
for example, I had the booster in we got it in October. Okay.
Right.
So, when should I get another booster?
Right.
If I hadn't had COVID.
Yes,
for a second.
and you know what? I knew I should have gone to medical school. When I saw many of these questions, which are great questions, and I wanted to know the answers myself, I definitely had to do some research. So how long? Okay, that's not the one. Gosh, you're throwing me off.
Okay,
here.
I'm sorry. I went out of order,
No, that's
so I'm
okay.
sorry.
So, what is the optimal waiting period for getting another booster? So, let's start with the first booster.
Right.
So, let's say that you had Pfizer as your original vaccine. So, it was the 2 shots. I think 21 days apart between the 2 shots. And so if you want to get a booster, and everybody is eligible to get that first booster. So you are recommended that you wait at least 4 months.
From your last vaccine? From your last
Yes,
shot.
4 months from your second original vaccine.
Okay.
So they recommend that you wait 4 months, if I'm getting this correct. And I apologize. I was definitely on the fly, and so many of these questions were so close to each other.
Yeah.
Let me read it. So the CDC recommends that people who receive the Pfizer vaccine regimen wait 5 months. Wait 5 months before getting their first booster shot. If you are eligible to receive a second booster shot, you should wait for 4 months before getting your... Okay, thank you. Yes, it's good I go to my notes. So originally, Pfizer said to get your first booster shot, you should wait 6 months. Mm-hmm. They then changed that and reduced it back to 5 months. Now, everybody is eligible to get that first booster shot. Not everybody is eligible to get the second booster shot. So the CDC and the FDA are only approving a second booster shot for people that are over 50 years old or people of any age that have a compromised immune system. So not everybody is eligible to get a second booster shot. So you have to, that's why I said, if you are eligible to get a second booster shot, then you should wait at least 4 months after your first booster shot. So so to restate, original 2-shot vaccination, wait 5 months to get the first booster shot. If you're eligible to get a second booster shot, you should wait 4 months.
Okay.
Now that's assuming that you didn't have COVID during that time period.
Oops. Okay. All right. So
Yes,
let's go that
'cause that's
route.
another
Yeah.
one of your questions. How long after I have had COVID-19 should I have my second booster? Again, I'm going to read my notes here. So first of all, you shouldn't get your second booster until your symptoms have resolved. So you got COVID, assuming you had symptoms, because you could have also been asymptomatic.
Right.
But saying you're symptomatic, you should not get your second booster, again, if you're eligible to get that booster. You're over 50 years old or you have a compromised immune system. So you first wait till your symptoms are resolved. You then also have to wait for your isolation period to have ended. So no more symptoms and you're out of isolation. Isolation is if you are symptomatic or you contracted the virus and you're symptomatic, you have to be isolated for 5 days. So at the end of the 5th day, you're now out of your isolation period. So provided that you're out of your isolation period and you haven't had a fever for the last 24 hours, and without taking fever-reducing medication, then you can take, then you can get your second booster. So again, let's say you got your first booster, but then you got COVID. So when do I get my second booster? You get it when you no longer have symptoms, when you've been in isolation for 5 days and you haven't had a fever for 24 hours, then you can get your second booster. That's if you're symptomatic. If you're asymptomatic, meaning you had a positive test, but you never had any symptoms, you still have to isolate for 5 days. And so the only criteria then for getting that second booster shot is you have to have gone through that 5-day isolation. So you literally could, and remember again, we want between your first booster and your second booster, we want 4 months ideally. So if you never got COVID, you want 4 months between the first booster and the second booster. But if you're outside that 4 months and you haven't got it, but then I got COVID, then, okay, symptomatic free, my 5 days of isolation, haven't had a fever for 24 hours, I now get my second booster. Clear as mud?
Clear as mud.
Now here's the other one. Unless during that time you had COVID, that you took monoclonal antibodies to help reduce your symptoms or to just make it more certain that you wouldn't become severely ill. So if you went through all that stuff, you had your first booster, you then got COVID, but you decided to get monoclonal antibodies, which a lot of people did, then you need to wait 3 months from your last monoclonal antibody treatment to get that second booster. So this will
we need like a cheat sheet.
I know.
We
See,
need
that's
this in our-
why I was saying that. It's
Yeah.
it's complicated and to memorize
Right,
it.
right.
So fortunately, that's why we produce these written, Q&As. So we'll post those. But
Right, because this is going to come up tomorrow in the employee huddle too.
Is it? Okay.
Because people are concerned that if they're no longer considered vaccinated and they've gotten their first booster, but then people are saying if you don't get the second booster, you're no longer considered vaccinated. But what you're saying is that second booster is only approved for a very certain part of the population.
It is.
So I'm considered fully vaccinated, although I've only received one booster.
Yeah, and not to add to the complexity of it, but there's healthcare workers and non-healthcare workers. So the CDC is really only been speaking about all people and not healthcare workers specifically. So the CDC officially is still stating that you're fully vaccinated if you got the original shots. So the 2 Pfizer vaccines or the 2 Moderna vaccines or the single Johnson & Johnson vaccine, if you've had that, the CDC considers you to be fully vaccinated. It still highly recommends that everybody get a booster shot, everybody, and it highly recommends that if you're over 50 or you have a compromised immune system, they highly recommend you get a second booster. But those are recommendations. In California, with respect to healthcare workers, you are not considered fully vaccinated unless you've had a booster. So I guess outside of work, even if you haven't been boosted, you're considered fully vaccinated. But when you're here at the hospital or in a doctor's office, any California healthcare facility, to be considered fully vaccinated, you have to have had that booster.
Okay.
So that's, so you have unique rules that pertain to healthcare workers in California. The governor has stopped short of requiring all healthcare workers that are over 50 years old to get a second booster, or you won't consider to be fully vaccinated. There has been no indication that that's going to occur.
Okay.
So right now, we're all fully vaccinated.
Right.
Yes.
Okay, so the next question, can a person get boosted too many times?
Well, we'll see. Because again, right now, the FDA and the CDC have only approved and recommended a maximum of 2 booster shots. And again, there's specific eligibility to receive a second. You have to be over 50 or have that compromised immune system. Yeah. So there is no approval to get a 3rd booster or a 4th booster. And obviously there's a lot of conversation around that. There's a belief that, after so many months, the immunity, the effectiveness of the immunity starts to wane. And so there's a belief, Dr. Fauci, I was reading the article this morning, has essentially, in the United States, and it was clear that the pandemic still exists worldwide, that we as a global population, we are still in the midst of a pandemic. However, in the United States, we are transitioning to an endemic condition. So moving from pandemic to endemic. Endemic is like the flu or the cold. It never goes away, and it's there, and it ebbs and flows. And so if COVID is here truly to stay, like the seasonal flu, then there likely will be an annual COVID vaccine. It may be a series, it may be a booster, that every year we need to get 1 or 2 or more booster shots. So I think there's a tremendous amount of research that's being done around that right now. So the short answer is, can you get boosted too many times? That's still to be determined.
Yeah.
But right now, technically, you can only get 2 booster shots.
Okay, so does getting a booster decrease your immunity for other shots?
I don't think there's been really anything that I have seen that indicates that. I mean, we all got, again, our original vaccination was back in December of 2020. I know I got COVID in September of 2020, and then I think I got my booster in December of 21. I got my flu shot in November of 21. I did not contract the flu over the season, and I never got COVID a second time. So that would seem to suggest that my flu vaccination was unaffected by my COVID vaccination or even getting COVID. So I haven't seen any specific articles. I haven't seen anything that would suggest that developing COVID immunity would somehow suppress immunity against the flu or other types of viruses or diseases. So
yeah, so you're not seeing anything that the immune system is weakened?
no.
Okay. If you get too many boosters, do you build up any toxic levels in your system?
Again, I have not seen anything like that. Making certain that you again, follow the regimen, the spacing between a first booster and a second booster. I myself, I've only received one booster. I don't feel like there's any toxicity, that has built up in my body. I will tell you that I had zero reaction to the original vaccine. My reaction to COVID was mild to moderate, lasted a few days. But then when I got boosted in, again, I think it was November, December, I had I wouldn't say a severe, but a pretty strong reaction to that. And is that the buildup of something? I don't think, I think coming off of COVID and then getting the booster after that, my immune system response was probably just a lot stronger, which when you got the first vaccination, I talked to a number of pharmacists and our epidemiologists, and which kind of caused me to be a bit worried because I had no reaction. So does that mean I have no immunity?
Right.
Because everything I'd heard is, no, you want to have a strong reaction. You hope that when you get vaccinated that your arm hurts, you have chills and fever, and you feel like maybe you have COVID, because that's your immune system going into action and fighting what it thinks is the virus, because that's what we're kind of tricking our immune system with that vaccine. Emulates that spike-like protein, and then your body goes into action. So when I didn't get any response, I'm thinking, well, then my immunity is pretty low. But I think the fact that I had the big response to the first booster is that, my immune system was now pretty well charged. So I don't think it's a reflection of toxicity. I think it's just we're building on our immune system, but I definitely have not read anything about it causing, again, there's definitely, there have been not only just the expected symptoms, but there have been cases, we read about blood clots and some bad reactions, but they really are the exception. In the grand scheme of things, and the hundreds of millions of people that have been vaccinated, it's a very small fraction that have any kind of real serious physiological reaction to it.
Right. Okay. So we have changed our visitor policy in the emergency department. Do you want to review that?
Yeah. So I think it was effective yesterday. We now allow, first, for a long period of time, we have allowed 2 visitors to be back in the exam room with the patient. So we were not allowing visitors to be in the waiting room with the patient. So when the patient comes in, and there are exceptions where there can be, like for an adolescent or somebody that has some severe cognitive or mental health issues, we have allowed those exceptions to have somebody in the waiting room. But generally, there's been no visitors in the waiting room, but as soon as the patient is brought back into the exam room, then the patient can have 2 visitors by the bedside. So that's still in place, but effective yesterday, we now allow 1 visitor to be in the waiting room with the patient. So it doesn't have to be one of those exceptions. So every patient is now allowed to have 1 visitor accompanying them in the waiting room in the ED and waiting with them. But then when the patient goes back, that visitor can go back with them, and another visitor can accompany them at that time.
Okay, that's great. That's great news.
Yes, yes.
Yeah. It's going to be a change for our staff, but it is great for our community members.
And Deborah, I think, that's been kind of our commitment,
Yeah.
And I know I always say it's probably been the most difficult and frustrating element, not just for patients and families, but for our staff as well. It's been very difficult. Having loved ones at the bedside, I've always said is part of the care process. Mm-hmm. Having families and patients very involved in their care. So we've had to loosen and tighten throughout the entire pandemic as the surges, rise and fall, and so. This change that we have just made is really, again, consistent with that. It appears that the virus is kind of subsiding a bit. Mm-hmm. Although what's really interesting, again, I either read it today or yesterday, that there definitely is an uptick in the positivity rate. The number of new COVID cases that are being reported in Tulare County and statewide is on the rise. This may also, I think, be the case across the country and worldwide, but fortunately, we're not seeing an accompanying rise with hospitalizations and deaths. Mm-hmm. So definitely the virus is still here. And unfortunately, the whole herd immunity thing. You kind of think, once 70 to 80% of the population has either been vaccinated or has contracted and recovered from the virus, then the virus will just die off. Well, what we're finding, though, is as these new variants emerge, fully vaccinated people that have had COVID and recovered, are getting COVID again. Or getting COVID for the first time, even though they've been fully vaccinated mm-hmm. and boosted. Mm-hmm. And so I think it definitely is kind of define historical experience mm-hmm. with viruses, and the fact that it's not dying off. It seems that it's fighting on hard. And mm-hmm. I heard a story yesterday on the radio that there still is a firm belief that this virus was manufactured in a laboratory, that it wasn't a natural phenomenon. And so because it was manufactured in a laboratory, it was almost created to be this elusive, this strong, this, not to die a normal death as a virus, that it just has been programmed. Now that might be conspiracy theory or whatever, but it certainly is not given up. It's still out there fighting.
Right. We did a memorial service, a short memorial service for all of our employees who had passed in the last year. In 2021. And so the question came in, and this was not from COVID, this was just a memorial thing that we started doing last year. So the question came in, why does the memorial of Kauai Health employees and physicians only go back to 2018?
Yeah, and this really emerged out of our employee connection team. We actually have a group of employees that work together to implement new programs, things to keep our employees engaged and recognized all the time. And it really was their brainchild to erect the memorial fence out in what we call the Kauai Park, just off of West Street here. Beautiful creek that runs through it, and there's beautiful flowers they're blooming today. But it was their idea that, to kind of reach back in time as far as we could go back, where we had really accurate, confident records. And so they picked 2018 as kind of that starting point. And obviously, we were created in 1961. We started operating the Visalia Municipal Hospital in 1963. I am employee number 39,225. And we're up to, over 80,000. Our new employees, probably 80, 90,000. So there have been many people over the years that have worked for Kauai and that have passed on, but we really didn't keep records of it. So they kind of, how far back do we think that, we can accurately rely on our records in 2018. So you had to pick a point. And we really contemplated, can we talk to people? Can we interview people, those that are kind of the historians, and see if we can put together a list? But we know we would leave people out, and we didn't want to do that. So we felt confident in starting with 2018, and that'll be the date forevermore. And as I said in my remarks on Tuesday, I hope over time there are very few plaques that are affixed to that fence, and that it remains sparsely populated. These are employees, physicians, advanced practice providers, those that are part of the Quia Health family that died while actively employed by Quia. Certainly, people that retire over the years and that will retire in the coming years, they ultimately will pass on as well. And we will always, think deeply about them. They'll always be part of the Quia Health family. But this memorial was really designed for those that passed away while they were current employees or current members of the medical staff.
Okay, so we've talked about this a few times in the past too. We've been asked if there's going to be any kind of recognition or memorial for the COVID-19 patients who have died at our hospital in the last couple of years.
Right. And it's a great question again. And there is something that is in the works right now. It is not specific to COVID patients, but perhaps COVID has been the catalyst behind it. So sadly, I think we had 15, the county reported maybe 13 to 15 people, Tulare County residents, passed away from COVID this last week. So that number continues to rise, and unfortunately is the largest hospital in the county. Many of those patients passed away at Quia as we worked to try to save them, but it was impossible. So many more, thousands of more patients fully recovered from COVID while after being hospitalized here, but sadly, probably approaching 1,500 or more died. But you think about at a hospital, there are many patients who sadly pass away of cancer or a major stroke or a major trauma, and every patient that is cared for at this hospital but does not survive is deeply impactful to our staff and our physicians, and it means a lot to them to have been the people that cared for them at the final moments of their life, and it really it leaves a lasting memory on our employees and our physicians. And so we wanted to create a memorial that really recognizes all of those patients that we have taken care of over the years that passed away at Quia and put their lives into our hands. And so we will be erecting a memorial. It has a beautiful poem that will be inscribed on that memorial that actually was written by one of our own employees. And so we are in the midst of finalizing that. It'll be a beautiful monument, and again, a memorial celebrating the life of all those folks that we cared for in the final moments of their lives, which will include all of those. It won't be inscribed. It won't be like what we do with the employee memorial. So it won't be memorializing any single individual. It'll be for all time, and all patients in the past and all patients in the future, but certainly those that passed away because of COVID will be very much enshrined in that memorial.
Okay, all right, thank you. So Gary, we hear often that our parking is horrible. It's not a secret to anyone. And so we talk a lot about future facilities and future things that we're going to do for parking. Are we doing anything for parking in the short term, something that's immediate?
Yeah, we continue to work. Mark Mertz, our Chief Strategy Officer, and I now routinely meet with Leslie Cavilla, the city manager of Visalia, and parking is always on. We meet bi-monthly, and parking is always like a permanent agenda item, and we really appreciate working with the city and Leslie and Nick. But the city is actually commissioned, I think it was funded by a grant, but something that they've wanted to do that's really for us is to do a formal study of I would say, parking, traffic flow, congestion around largely our downtown medical center, but really looking where our 5,100 employees live, and to see if there is a density pattern of sorts. So if we find that there's an area of Visalia or some area in our community where there's a large number of Kuya Health employees that live in that area and work in the downtown medical center, to create some ride-sharing programs so that they wouldn't be parking or having to park downtown, which then frees up parking for visitors and other folks. So that study, I believe, is underway, and it is very specifically for us. So the city has hired that consultant. We also, and I know this doesn't have to do with parking accessibility, but the safety of parking is a big issue too. And so again, we've been working closely with the city to really improve the safety of the Asequia wing, greater presence by security. We are working on a lighting project to potentially install additional lighting, as well as much brighter lighting. So those efforts are underway. I think for us, it's more the long-term solution. So relative to the master facility planning efforts, and I think I've shared with you that overwhelmingly all the community members that we have engaged with over this last year, as well as our board of directors, overwhelmingly supports the construction of a single 9-story, might be 10-story tower that will include 240 new beds, as well as a new dietary, cafeteria, pharmacy, storage. But that plan also includes the construction of a 500 parking space garage. So we're envisioning that will actually be across, so west of West Street, where our finance building is currently located. So obviously we will relocate them before we tear it down and build a 500 space. Melinda Tupper and her team will appreciate that. But yeah, a multi-storage, much like the Asequia wing parking garage. And we're kind of envisioning that parking garage will be dedicated to employees, physicians, perhaps visitors or patients to some extent. But what we want to do is, pull all of our patients and our providers, all of their cars out of public parking, out of the Asequia wing parking garage, surface parking, other city-owned parking lots, to pull them all out of there so that significantly increases the availability to the general public. So, but that's a number of years off, so we'll just have to continue to be patient. And but in the meantime, we're again actively working with the city and always exploring opportunities where we can increase that parking. We are looking at opportunities where we can move certain departments that are, say, within the acute medical center, or our patient accounting departments located on the corner of Locust and Asequia. We have our call center that is down Main Street near the Wells Fargo building, and they don't have to be in the downtown area to do their jobs well. They're really, they can be almost anywhere. So we're exploring ideas of moving them out of downtown to other areas, which then frees up parking. Our staff won't be there anymore. So things like that are probably more immediate, short term that we could do.
Yeah, well, that's exciting. How many, do you know off the top of your head, how many people work here at the downtown campus physically?
I don't.
It's a large,
Yeah.
it's a big number.
I mean, it's our single largest facility, 435 acute care beds downtown. So you think we've got a 54-bed hospital on Court Street. We have our 63-bed mental health facility and our 61-bed acute rehabilitation hospital on the West Campus. So 435 beds, 5,100 employees. I don't know if they're all equally proportioned, but I would imagine 2/3 of them work in downtown Visalia.
Right, right. We have a huge economic impact on downtown Visalia.
Yes.
Big.
Which is why we stayed downtown
Right.
and instead of
Right.
moving out.
Right.
Yes.
Okay, so speaking about the master facility plan, there was an article in the Visalia Times Delta last week, and it kind of started stirring that pot around the master facility plan, future general obligation bond, social media started getting a little crazy. And so the main concern on social media is the same concern that we encountered in 2016, is that those who live within the district are the ones who pay the taxes, while those who live outside of the district still can access care.
Right.
And so this really is an issue, and everyone on this call, I recognize all of their names. They've sat in on stakeholder meetings, they're ambassadors. They know, they have sat through the presentation of redistricting. And so the real issue is this is not a decision that COEA makes in regards to districting.
No, absolutely. Obviously, we initiate it.
Right.
So we're the ones that kind of get the ball rolling. And first, let me digress just a bit. I don't know exactly what triggered the media's interest. I mean, we've been working on this master facility planning all the way back actually till to the year 2000, which gave rise to the Asequia wing, which opened in 2009. But we have been, probably for the last 3 years, have been working on, the plans for downtown and all the different iterations and working with the stakeholder groups. And then just out of the blue, the Times Delta reached out to us and wanted to talk about, the plans for downtown. So that's not something that we wanted to send out a press release or we triggered anything. And frankly, I don't know what triggered it, but in our commitment to be transparent and forthcoming with the public and the media, we agreed to do the interview, and we're very open again and transparent with them, and it did stir the pot. I just want to underscore that we are I wasn't really happy with the headlines because it kind of implied that we've made our decision and we're building this $500 million plus 9-story tower and it's going to happen, and that's nowhere close to where we are. We're still very much in the planning phase. We're still finalizing exactly, is it going to be 9 stories, 10 stories? We're now going to start working with our staff planning, what it looks like on each of the floors, and finalizing the cost and how we're going to fund it. And I will say, there's no way I cannot say this, that it will only happen with the community support. I mean, we cannot fund it, on our own, which I would love to be able to do that, but it's just not practical, at the cost. And while I think we're a well-run hospital, we're certainly, trying to recover from some real financial damage that was caused by the pandemic. But even in good times, our margins are 2-3% because of the payer mix. When more than 60% of your population is Medi-Cal, you're just not going to be a highly profitable hospital like Hoag in Newport Beach, which would, they have hundreds of millions of dollars in cash reserves, and they could probably fund their project all by themselves. It's not possible to do that here. But we do want to keep any general obligation bond that we do present to the voters, that we want it to be as small as it possibly can be, so that we fund most all of it ourselves. So I just want to, again, reiterate that this is very much in the planning stage. It is not even close to be a done deal. The board has not given us approval to move forward. They just have given us approval to continue with the analysis and the study and putting together the plans. And we will be launching probably this fall another full round, probably months of working with the community and holding town halls and other stakeholder groups, just to keep them very engaged and soliciting their input and again sharing everything as we go along. So that's the objective. But to your question, that's also been part of the planning. So myself, Mark Mertz, Dave Francis, we've met a couple times with the board of directors of the Alta Healthcare District in Dinuba with the idea of merging their district into ours. We've also had similar conversations with the board of directors of the Exeter Healthcare District about merging into our district, and we've been very upfront with them. Our motivation is to help broaden the taxpayer base. Both of them are the first to state that Quia is our hospital. Probably 85-90% of the Exeter residents come to Quia for all of their hospital care, and so they very much consider Quia to be their hospital. Dinuba, maybe 50-50, go to Fresno versus coming to Visalia and Quia. So to your statement earlier, we cannot force a merger. LAFCO cannot force a merger. That's the local agency formation commission. LAFCO essentially oversees all special districts, so water districts, mosquito abatement districts, healthcare districts. Everything we do, to change our boundaries or to merge with another district requires the approval of LAFCO. And so we can't make these other districts pay a tax or merge with us. Neither can LAFCO. It has to come from us. Our board has to first initiate it and essentially reach out to their counterparts, reach out to these other boards, and then their boards have to agree that this is that's something they want to do. If both boards agree on it, they then have to go to the public and explain what they want to do and why they want to do it, and then the public is given the opportunity to protest. And if a sufficient percentage of the population protests, then LAFCO will trigger a vote where it actually is now a ballot measure. And the people in the Quia Healthcare District and the people in the Dinuba or Exeter Healthcare District now have to vote to approve it. If there are very little protests, then LAFCO can actually just make it happen. And we merge and they become part of our tax base, and you don't have to go through a vote. So we continue to explore that, at least with these two healthcare districts right now. It is highly unlikely that the Tulare Healthcare District would ever merge with us and want to support a tax measure to build a new Quia facility. Because they support their own hospital. Now, it's not a district hospital anymore, it's run by Adventist Health, but they have their own hospital and they would want to support their hospital. Same with Sierra View Hospital in Porterville. It's also a healthcare district, but they're going to support their own hospital. So that really leaves Lindsay, Exeter, Dinuba, Kingsburg are the other 4 healthcare districts that don't have hospitals. And so those are the healthcare districts that would potentially merge with us and expand that tax base. But all of them, up to this point, have indicated we want to stay independent. Lindsay Healthcare District came out on record right away when they heard that we were, exploring this idea. They were saying, no, that we like being our own healthcare district. We have our own board of directors. We use our tax funds, that percent of the 1% property tax. We get to use it for our healthcare related matters. And we appreciate Quia and support them. but we're going to stay independent. Alta has kind of said the same thing. Exeter, they use all their tax revenue to run an ambulance service, and I think you've probably read in the papers over the last couple of years, their healthcare district, the ambulance company, is really struggling. In fact, they only have 2 board members right now. They lost their CEO and their attorney. They're very interested in the idea of merging, and they might be the most likely folks that will come in. Now, the caveat I always put out there, and again, I've said, this is the most contentious issue of the entire failed Measure H campaign, was exactly the question you posed. And we heard the public loud and clear. That we then started talking to these healthcare districts, but we also engaged Quad and Off to conduct a pretty in-depth analysis of what it would mean. And so I'll use the Alta Healthcare District as an example. So the 183 square miles that make up the Quia Delta Healthcare District, the assessed value of taxable property that lies within our healthcare district is probably approaching $15 billion. The assessed value of property in the Alta Healthcare District is about $2.5 billion. So if we were to merge the healthcare districts, that the tax base now would be the combination of our $15 billion and their $2.5 billion. So we would have to, if we issued GO bonds, we would have to collect enough property tax every year to pay the principal and interest that came due on those general obligation bonds in that year. Every property owner would pay the same rate per $100,000 of assessed value. So say it was $50. So if you own a residence in Dinuba, you'd pay $50 per 100,000. Same in Visalia. But the median value of a property in Visalia is more than twice what it is in Alta, or the Alta Healthcare District. So you'd raise enough tax revenue in the Alta Healthcare District to reduce the tax liability of a Visalian by about $7 a year. It's a pretty nominal amount. If say it was $50 per 100,000, it might only be $3 of that 50 that would not have to be paid by Visalians anymore. Which is still, again, it's a lower tax for Visalians, and I think it would make people feel better that they're sharing in that tax. But now, all those voters that live in Dinuba are voting on what happens in downtown Visalia, what happens to our medical center. So you remember that it takes a 2/3 positive vote to pass a GO bond for a healthcare district. So you could have Visalians vote overwhelmingly for this GO bond to build their new hospital tower. Maybe it's 70-75%. But if the people that live in Dinuba that maybe go to Fresno for care, which is about half the population, if they all vote no, then it could pull down the total vote to below 2/3. And so that's the risk that you have when you merge these surrounding districts that would contribute but may not necessarily vote for something that's going to happen outside of their community.
Right.
Now you hope you help them understand, and they do appreciate that what happens in downtown Visalia affects the health and well-being of their communities. Right. So you hope that is the case. But
we have a chat about the 67%. Okay. So is there a chance that the state could change the percentage of the vote required to carry a bond?
I've proposed that several times. I've talked to many of our legislators about that. School districts only require to meet a 55% threshold. And I've talked about that. Again, there are only 35 healthcare districts in California out of 500 hospitals. So you might think, well, that would make it easier to lower the threshold for healthcare district bonds. But at the same time, it's like we've got bigger fish to fry, and you know, they haven't seemed to want to move on that particular. I don't know if it would come up against resistance to lower it. I think, you know, definitely making it easier to pass local taxes. You know, you definitely have your proponents and your opponents to that. Although I think the general community member, I'd rather pay a local tax than a state or a federal tax, because I know that my taxes, you know, I'll get to experience and benefit from, you know, what happens in my own community. So it doesn't appear likely that anytime soon that they would lower that threshold. But then, I'm sorry, just my last point, and I think you alluded to that. I do think it's important for Visalians and people living in the Kaweah Delta Healthcare District to appreciate that, you know, the 80 to 90% of Exeter residents that come to Kaweah for their care, you know, most all of them are insured by either Medicare, Medi-Cal, Anthem Blue Cross, Blue Shield. And when they come here for their cardiac surgery or to deliver their baby or have their hip replaced, or, you know, that generates revenue for Kaweah. It generates profitability. And we then use that profitability to pay for this 9-story tower, because it won't all be paid for with just a general obligation bond. We will use our cash reserves, we'll use our operating funds, we will go out and borrow our own funds using revenue bonds that get paid from the profits of our healthcare center. So when they contribute profit, they are in effect helping fund that new facility. We will use their funds to pay that revenue bond. Now, I understand that, you know, the argument, well, yes, those of us that live in the healthcare district, we bring that same revenue and profit and we pay the tax, and I appreciate that.
Well, this issue is not going to go away.
No.
I could tell as I was reading those social media comments, I'm like, here we go again, and it is, you know, it's going to be a challenge answering that question.
Well, and again, I think I shared in that article that the earliest that we would go to the voters is probably November of 2024. So more than 2 years from now. That's a general election. We definitely learned doing a special mail ballot in retrospect was not the direction we should have gone. So again, we want it to be as open, honest, transparent. We don't want anybody to have, you know, any concern about secrecy but I need ample time to be able to go out and discuss that in depth with a lot of people. That's going to take some work to gain that support.
Right. Okay, well, you've covered a lot for us, Gary, so.
I used up every minute just as we predicted,
we
so.
enough time for you to say.
Yeah, just again, thanks for being here today. Great to see kind of a variety of topics today, although certainly COVID is still all on our minds, but I really appreciate your interest in other aspects, and again, I appreciate the unique role that all of you have taken on to be ambassadors and spokespeople for the organization, and I just really enjoy coming to you every couple weeks and bouncing things off you, but also being the first to share with you. You know, certainly talking about the patient memorial today. I don't want you don't have to keep that a secret, but you're really the first to hear about it. We really haven't even talked to our own employees, but that will be forthcoming soon. But again, you're kind of you're part of the Kaweah Health family, and I just want you to be always in the know when it comes to all stuff Kaweah. So thanks for being here again today, and I'll see you in a couple weeks.